It went from tremors in her hands to everything shaking.
I hated watching her suffer like that.
No one had any idea what she had.
The whole family would be like, "Mom, please talk." And she'd be like, "I can't."
I felt that I can't go on like this anymore. This is the end.
Next, two medical mysteries that defy the experts. When Rob and Maria Lazzaro bring their seemingly healthy newborn home, little do they know they'll soon be in a desperate fight to save her life.
She didn't see for the first few months of her life very well. I just was thinking, oh my God, there's something in her brain that's causing all these problems.
It's the worst nightmare that you could ever imagine in your life.
Then, Eileen Collins is faced with a bizarre vocal disability
Patrick, can I have the sports section, please?
that threatens to silence her life.
People thought that it was psychological, and I knew that it wasn't. I'm not crazy.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. When court reporter Maria Ferrara met a young attorney named Rob Lazzaro in December of 2000, one thing was clear right away. The two had chemistry.
He seemed very sweet, you know, caring. He was funny.
We had similar interests, and we got engaged within a year, and were married soon after that. Both of us always wanted to have children. And I always dreamed of coaching one of my kids' teams, baseball, softball, or, you know, whatever it may be.
I think it was November of that same year that I found I was pregnant.
Maria's pregnancy flies by without incident, and on August 8th, 2002, she goes into labor.
I remember driving to the hospital. It was around midnight, 1 in the morning.
I did not know at the time what we were having. We decided to be surprised.
I remember when the baby came out, he goes, "What were your two names?" We said, "Jake and Samantha." He says, "Well, say hi to Samantha."
She was 6 pounds and she was 18 inches. She was just perfect. She looked like a doll.
They were just wonderful, doting parents, and Samantha was the light of their life.
When Samantha is 4 days old, Maria and Rob take her in for what they assume will be a routine checkup.
The doctor was examining her, and then the doctor kept looking in Samantha's eyes.
So she said, "I just want to talk to one of my colleagues."
But nothing could have prepared them for what the doctor says next.
The other doctor came in and looked at her eyes. She said, you know, Samantha has cataracts.
A cataract is a clouding in the lens of the eye that obstructs the passage of light to the retina, resulting in blurred or distorted vision.
I was definitely in shock. I know older people get cataracts, but I've never heard of cataracts on any child.
The doctors didn't know what was causing her cataracts. It was just something that happened.
As Rob and Maria listen in stunned silence, the doctor delivers more alarming news. Because an infant's brain develops so rapidly, their daughter will need surgery to repair the cataract as soon as possible.
The fact that she had to have surgery was horrible. It was heart-wrenching. She was very tiny. She was just a baby. She doesn't know what's happening, and I have to take her into surgery.
Terrified of the risks associated with surgery on a baby so young, Maria and Rob bring Samantha in for the procedure when she's just 5 weeks old.
I walked her into the actual surgery room, and I remember them putting her on this clear metal silver table. And then I lost it because they put the mask on her. I remember walking out, talking to Maria.
He was hysterical. Hysterical. It was awful. It was just awful.
After an agonizing 3 hours, the surgeon declares the operation a success. and the Lazazaros breathe a huge sigh of relief.
Couldn't be more happier. You know, we were like, that's great. You know, she had a problem, it's resolved.
She had this big patch over her eye with tape. And I cried, of course, but I was happy that she was good.
Over the next few months, Samantha's eyes slowly begin to heal. But it isn't long before Rob and Maria start to notice something else out of the ordinary.
You know, 3 months you're supposed to roll over. She rolled over, I think it was 5 months or 6 months. So she was later. My pediatrician felt, you know, she didn't see for the first few months of her life very well. She's going to do things a little bit later than the typical child would do. It wasn't a huge concern to the doctor at that time.
But Samantha's first birthday comes and goes with little progress. And as their daughter continues to miss key milestones, the Lazazaros grow increasingly alarmed.
For a year, she was only 16 pounds, and I think, you know, most babies are probably like 22 pounds, so she was definitely way below. Samantha wasn't walking yet. You know, my sister's son was 3 months older than my daughter. He would run, he would jump, he would do all these things that my kid wasn't even coming close to doing, so it was like devastating to me. So that was probably one of my big, you know, red flags. But at this point, I really started to feel like something's wrong.
Determined to get to the bottom of Samantha's delays, Maria schedules an appointment with a pediatric neurologist.
The neurologist was concerned because she wasn't doing all these things. He measured her head. He said she has microcephaly.
Microcephaly is a rare neurological condition in which the brain fails to grow at a normal rate, resulting in an abnormally small head size.
You know, he said, let's do an MRI and see if we can find anything wrong with her. I was nervous, thinking maybe there's like a tumor. I just was thinking, oh my God, this is probably what it is. There's something in her brain that's causing all these problems.
But the MRI shows nothing out of the ordinary.
The neurologist just said, let's just see where it goes, because she's still very young and things could change. If you look at her, proportion-wise, she's pretty proportionate between height and weight and head size. She's a tiny kid. So I wasn't thinking anything of it.
Maria's relieved to hear there's nothing seriously wrong with her daughter. But despite doctors' assurances, Samantha continues to fall further behind.
Samantha didn't really have much speech. She wasn't really saying like mama, dad. That, to me, was a big issue.
Unsure of what to do next, Maria starts sending Samantha to physical therapy several days a week. But progress is painfully slow.
Samantha would scream during the therapy sessions, and I didn't think it was doing anything. I didn't see any improvement, and I hated watching her suffer like that.
Dealing with Samantha took a huge toll on the marriage. There's like just tension in the air. We never could meet in the middle when it came to Samantha.
It was causing a lot of stress on us because we wanted to know why she's not meeting these milestones, what's going on with her.
I wasn't sure what to think at this point.
She always knew that there was something. She didn't know what it was, but she knew that there was something about Samantha that was different.
Since the day she was born, Samantha Lazazaro has been developing more slowly than other children. And at 16 months old, she still can't stand on her own.
I was starting to worry now because I felt that by this point she should be doing things, catching up, and she wasn't catching up.
But around the 1.5-year mark, things take a sudden turn for the better.
She started walking, which was encouraging.
She was advancing, so every doctor would tell us as long as she's advancing, that's a good thing.
And she kind of went from wobble walking very slow to, she kind of just took off one day and literally was running. And it was a sense of relief at that time that she's going to catch up, she's going to be okay.
For the next few months, Maria and Rob marvel at Samantha's progress. But just when they think they're out of the woods, a frightening new symptom begins to emerge.
We noticed her hand a little shaky, like she couldn't drink out of a regular cup, she would spill it.
A little subtle shaking in her hand. And then, you'd see like a little bit of her head shake a little bit.
Terrified, Maria schedules an emergency appointment with their neurologist, who performs another MRI. But the results are the last thing the parents were expecting.
An MRI didn't show anything. She said, there's really nothing here. Everything seems pretty much okay.
I was hoping maybe something would show up. Now we're starting to get worried that, what's going on here.
Over the next few months, Samantha's frightening shakes go from bad to worse.
You saw deterioration every day. And it went from tremors in her hands to tremors in her body to everything shaking.
She could do less things. It was inhibiting her ability to walk. So in that year, she stopped walking completely. So it was confirming to me, there's definitely something wrong with this kid.
Determined to find an explanation, Maria takes Samantha from doctor to doctor.
I went to neurologist, endocrinologist, physiatrist, orthopedist. I mean, you name it, I went to that doctor. All the doctors were baffled. No one had any idea what she had.
Marie was trying everything, and no one was giving us answers.
At the end of their rope, the young parents begin to accept that they may never know what's plaguing their little girl and do their best to get on with their lives. Then, in the winter of 2004, they make a momentous decision.
So we decided that we want to have another child.
Of course I was really nervous, but I thought, this is what's going to save everything. Save Samantha, save me, save him.
And it was not a long process. She was pregnant pretty quick.
I remember they started testing immediately for any kind of possible genetic problem, for anything that could be wrong with the baby. And everything came back perfect.
All the doctors were saying, I'm sure the baby's going to be fine. This one will be different.
On October 21st, 2005, Maria gives birth to a son they named Jake.
Everything went well. The baby was out. It was a boy, and his name was Jake, and we were very happy about that.
So they all have the baby, and, they're all talking, and I'm saying, how is he? And he's saying, he looks great.
But Maria only has a few moments with her new son before the unthinkable happens.
The ophthalmologist came in.
He took Jake outside to examine him, and he came back about a half hour, 40 minutes later, and he didn't look happy. He said he's got cataracts.
I just took Jake, and I was crying. I was hysterical. It was probably the most hysterical I've ever been in my life. Now it's went from bad to worse. So whatever she's going to go through, he's going to go through, and I have to go watch it all over again.
It's the worst nightmare that you could ever imagine in your life. It was overwhelming.
Rob and Maria Lazzaro have just received devastating news. Their newborn son Jake appears to have the same mysterious condition as their daughter, who still can barely walk or talk at age 3.
Like, here I am with 2 kids that are just going to have this disability. I don't know what's wrong with them.
Once again, the Lazzaros endure the stress of risky surgery on their infant child. And although the procedure is successful, the stress on their marriage is only increasing.
All these things that are happening, Samantha, Jake, the cataracts, was just, making the marriages worse.
And It was tough. It was causing a lot of stress on us because no one was giving us answers, and there was no cure for these things.
Eventually, the strain proves too much for the couple, and shortly after Jake's birth, they decide to end their marriage.
My feeling is if you're going to be fighting every day, you're better off not being with each other because it's not good for your kids.
The kids I didn't think would be affected because I would be there. I moved about 15 to 20 minutes east of where the house was to an apartment, but I would be there almost every day.
The divorce is painful, but it only strengthens Maria's resolve to find out what her children are suffering from. Over the next 2 years, she visits doctor after doctor to no avail.
As time went on, she just forged forward, and whatever she needed to do, she did, and it never stopped. She wasn't letting anything or anyone stop her or slow her down.
Then, in the summer of 2006, Maria takes 5-year-old Samantha to see Dr. Swati Sathe, a specialist in genetic neurological diseases at the NYU Medical Center. But unlike so many doctors before her, it's the very first entry on both children's medical records that catches her attention.
What struck at that time when I was going through her notes was the congenital cataract. The cataracts were the biggest clue from the beginning.
And she said, all right, we're going to do all these tests. And I said, fine, I'm not opposed to it. You know, I want to know.
We narrowed it down to like 4 possibilities. And so we sat down and discussed these diagnoses with her.
So we were in the office. One of their, I guess, genetic books was on the table, and it was open to this page of a boy, like a very emaciated-looking boy. And I said, oh, God, what's that?
It shows a rather thin-appearing child, looking much older than the actual age of the child.
She said, you know, we're going to test for that too, but it's so rare that it's highly unlikely that they have this. So I went home from Dr. Sathe's office with this picture of that boy just stuck in my head. And I just sat on the computer. And the website I got was like a list of symptoms. Short stature, delays, tremors, cataracts. And I started looking at pictures. There was a memorial of all the children that had passed away from this syndrome. There was probably about 80 kids that had passed away, and it was horrible, horrible.
I think she called back just a couple of days later, and she was crying on the phone. And she said, you know, I want to get that test done. I think this is what my children have.
That same afternoon, Dr. Sathe sends Samantha's blood out to be tested.
Now you just have to wait and see what happens. So I was ready for the answer. I didn't want to hear the answer.
Finally, after an agonizing 6 weeks, the results are in.
So the molecular testing confirmed that there were sequence changes in Samantha's and Jake's genes. Both Jake and Samantha had a condition called Cockayne syndrome.
Cockayne syndrome is a rare hereditary disorder in which a genetic mutation limits the ability of DNA to repair itself. In a healthy individual, cells are constantly breaking down and regenerating. But in patients like Samantha, the mutation obstructs this function, triggering a progressive cellular degeneration and essentially speeding up the body's aging process.
Cockayne syndrome is based on the symptoms. So in Cockayne's, there's premature aging or progeria where they bypass the youth and the adulthood and they just go from being children to old people. To make a diagnosis like Cockayne's, it's sealing somebody's fate. Most children with Cockayne syndrome are known to succumb by the age of 7 years. There is no cure for Cockayne syndrome.
This is the worst answer that you could ever get in your life. Both kids are going to die by the time they're 7. Jake was 1.5. Samantha was 5 already. It was just the realization that your kid's life is more than half over, that tomorrow she could die.
I remember her calling me on the phone saying to me, I was driving in my car saying to me, we found out what it is. I remember pulling over, just crying. I mean, what do you do when you find out that something like that?
After years of trying to find a diagnosis, Maria and Rob Lazzaro have finally learned the devastating truth. Their son and daughter both suffer from an incredibly rare and always fatal disease called Cockayne syndrome.
It's great to have an answer, but this is the worst answer that you could ever get in your life.
And troubling questions remain for both parents. First and foremost being why so many doctors were unable to put the pieces of the puzzle together.
There are about 150 cases of Cockayne syndrome described in literature thus far. And since it's so rare and physicians may not have seen it, it's difficult to diagnose.
But with a conclusive diagnosis now in hand, all of Jake and Samantha's symptoms suddenly make sense.
Samantha's clinical features match those with Cockayne syndrome. The congenital cataract, the tremors, the inability to keep up with her growth curve, and microcephaly. However, the exact mechanism underlying the development of these features in Cockayne syndrome is not explained.
While there is no cure for Cockayne's, many of its symptoms can be managed.
So we give medications for the tremors, correct the congenital cataracts, physical therapy.
And new developments in the treatment of Cockayne's are currently in the pharmaceutical pipeline.
There is a drug coming out that's hopefully going to be out next year that's supposed to stop the progression of Cockayne syndrome.
This drug has shown some promising results in animal models and so far has been shown to be safe for consumption in humans. So hopefully when the trials begin with this new medication, we'll be able to enroll Jake and Samantha in the trials and see how they do with the drug.
Today, although Samantha and Jake continue to suffer from many delays, they're living remarkably full lives.
Maria's goal is to prolong these children's lives as much as possible, but not to diminish their quality of life. She's amazing, and the kids are amazing.
Samantha's the happiest she's ever been now. Medication's helping her, she's less shaky, she's doing a lot better than she was even 2 years ago.
They love water, anything with water. She's self-sustained and she loves to be independent, you can tell.
Samantha turned 7 on August 8th. It was her 7th birthday, which she shouldn't apparently be here for, and she's very healthy.
And from this point forward, Samantha's making history every single day.
I don't really plan the future. I kind of plan like the day by day. Everything I do every single day is to make my kids happy. That's all I do. Once you get used to your life and the way, this is your life. You only have one life. Don't take anything for granted and be happy.
While the Lazzaro children exhibited startling symptoms from the moment they were born, Eileen Collins was perfectly healthy until a mysterious disorder threatened everything she held dear. In the fall of 2007, the Collins house in Harrington Park, New Jersey, was a busy place. Patrick and Eileen Collins commuted every day to demanding jobs in Manhattan, while their 2 teenage children usually kept things hopping on the home front. But the one voice that held it all together was Eileen's.
Eileen is very vibrant, very outgoing, very vocal. She tends to be one of the louder people in the room.
I play soccer. She is always the loudest person on the sideline. All my friends know that it's my mom yelling, and when she's not there and she's not yelling, they all ask me where she is, because she's sort of like the team mascot.
Eileen's big voice and confident style had always been a big plus in her professional life, too.
I am a salesperson of a TV network. I sell commercial time for programs. Relationships are extremely important in my business. My voice is who I am. It's my personality.
But one seemingly ordinary morning in September of 2007, Eileen wakes up and she doesn't sound like herself.
I woke up and I noticed that I had a raspy voice. Many people wake up with raspy voices. Nothing abnormal about that. And then by the afternoon, it was gone.
But oddly enough, the next morning, her raspy voice has returned.
Many things were going through my head. Did I scream too much the night before at my children's games? Did I talk too much on the phone? Am I getting laryngitis?
By the afternoon, her voice is mysteriously back to normal. It's the beginning of a strange pattern.
In the morning, it's very raspy, and then by the afternoon, it would come back to normal. And this repeated itself for a while.
Eileen has always had a unique sort of throaty quality to her voice, so I didn't think much of it.
At that point, I was thinking that it definitely will go away on its own. I didn't think it was anything serious.
But over the next few weeks, the puzzling condition only seems to get worse.
It progressively went an hour later each day with the raspy voice. My voice sounded like I smoked 2 packs of cigarettes a day. Patrick, can I have the sports section, please? I was using throat lozenges. At that point, nothing was helping.
After 6 weeks of living with the irritating problem, Eileen gives up on the idea that it will go away by itself and schedules an appointment with her family doctor.
The doctor looked down my throat, the doctor felt my throat, and the doctor said, Eileen, I see nothing. He said, how much do you sleep? And I told him, and he says, all right, well, try another hour. And at that point, I was just trying to listen to what he had to say, because he's the doctor.
Her first visit to the general practitioner sort of confirmed what myself and the rest of her family had told her, which was there was nothing to be concerned about, nothing to be alarmed about.
Although Eileen finds it hard to believe that her voice has anything to do with how much sleep she's getting, she starts going to bed an hour earlier every night. But the strange affliction shows no sign of improving.
Within a month, my voice went from raspy in the morning to raspy the entire day. Hello? It was constant at that point.
Then, while attending one of Kaylee's soccer games, Eileen makes an inadvertent and bizarre discovery about her condition.
I'm sitting in the stand, and my voice was raspy. But as soon as I got excited and started screaming, come on, oh, get down there! It was 100% normal.
She couldn't really talk, but she could yell.
Come on, Kayla!
How could it be possible that she can scream at full volume and sound normal and then turn to you and try to have a conversation on the sidelines and be really unable to speak in a normal voice?
Baffling as the contradiction may seem, the mystery only deepens when a few days later, something even more unusual happens.
I went to a cafe for a cup of coffee. When I went to say coffee, it sounded like fee. And I tried it again. Cough, pause, fee. And the counter person, excuse me, and I finally just pointed. I walked out of the cafe and said, okay, this is not normal. This is not normal. What do I have? What is wrong with me?
Over the last month, Eileen Collins' confident, booming voice has mysteriously turned into a raspy whisper. But now, she's developed a bizarre new symptom. Suddenly, her words are coming out in strangled bursts she can't control.
Almost sounded as if she were choking a little bit. It was just a real struggle for her.
It was progressively getting worse. I could not talk normally and get the words out.
Frightened by the strange development, Eileen arranges to see an ear, nose, and throat specialist.
So he did all his tests. He put cameras down my throat, and they take pictures of the whole area back here.
But after studying the images carefully, the doctor reaches a conclusion that sends Eileen reeling.
He said, there is nothing wrong. There's no damage to your throat. They are beautiful textbook vocal cords. He said to me, I think it's anxiety. I said, why am I rasping and sometimes I can't get the words out? And he said, because you're probably very stressed.
They suggested that she speak with someone that could maybe determine whether or not this was an emotional problem or a psychological problem and what brought it on.
Doubtful, but willing to try anything to get her voice back, Eileen reluctantly attends appointments with a therapist for several weeks.
The therapy didn't improve my voice at all. I was really mad and upset. Really, just someone please help. Because it's not stress, it's not anxiety, I'm not crazy.
But her husband, Patrick, isn't so sure.
And I am the type of person that I probably too much just, if someone's a paid professional and they're giving me their opinion as a physician, I accept it. She doesn't.
Patrick, he likes to listen to the facts. That's Patrick's personality. And the facts are, as of this moment, there is nothing physically wrong with you.
Eileen was upset by the fact that I was not sold on the fact that it was a physical ailment. So it definitely led to some friction.
We would get into fights a lot. The whole family would be like, Mom, please talk. And she'd be like, I can't. And it resulted in a lot of arguments.
To make matters worse, Eileen's deteriorating voice has been making it increasingly difficult for colleagues and clients to understand her.
Work at this stage was very difficult. Talking on the phone was horrible. It was a struggle from the minute I walked in to the minute I left.
I think that Eileen was concerned about losing her job. Eileen could not work effectively, could not communicate effectively, and I think that she was truly at her wit's end.
Slowly but surely, Eileen's confidence begins to erode, and she starts to wonder if the problem really could be in her head.
Over the next few months, I was trying to cope because nobody could tell me that something was wrong, and maybe I am a lunatic. I felt very stupid, very inadequate.
She was the most depressed I've ever seen her. She couldn't sleep. She cried quite a bit. I think that she had truly hit a wall.
People thought that it was psychological, and I knew that it wasn't. What is wrong with me?
Desperate, Eileen returns to the ear, nose, and throat specialist, looking for anything that could shed light on her condition.
I said, this is not working. Let's get to the bottom of this. And he said, fine, I'll give you this specialist. You go speak with him and see if he can find anything.
Eileen immediately schedules an appointment with Dr. Michael Pittman, an ENT and laryngology specialist based in Manhattan.
I walked into Dr. Pittman's office and I sat in the chair. And 5 minutes later, this man came in with a doctor coat on who was very young. And I said to myself, oh my God, this guy is too young to know anything about what's going on here.
So Eileen, when I first met her, was very distraught. We had to develop a little rapport. She was really desperate to find out really what was wrong.
Dr. Pittman begins his exam with a few seemingly simple questions.
He said, "What's going on, Mrs. Collins?"
When you try and diagnose someone who's having a voice problem, the most important thing is really just to listen to them. Every single person that I meet, you notice their voice. You begin to pay attention, begin to pick up all the nuances.
And after just a few minutes of talking with Eileen, Dr. Pittman makes a stunning announcement.
He said to me, "Eileen, I think I know what's wrong with you."
For the last year, Eileen Collins has been struggling with a baffling condition that has virtually destroyed her ability to speak. But now, Dr. Michael Pittman believes he has the answer.
Right away, she's like, "Well, what do I have?" And I said, "You know, let's just wait a few more minutes. Let's do some other testing, and then I'll tell you for sure what I think is going on here."
To confirm his theory, Dr. Pittman will need to take a close look at Eileen's vocal folds. The vocal folds, or vocal cords, are flaps of tissue stretched across the larynx.
The voice is like a saxophone, and the vocal folds are the reed. The vocal folds are actually what create the voice. When a patient has a voice problem, we need to visualize the vocal folds.
In order to inspect the vocal folds, Dr. Pittman must carefully thread a special camera down Eileen's throat.
I was looking to see if there were any spasms in the voice. When she went to speak, did the vocal folds actually spasm so tight that she had difficulty making sound?
Do you see it?
Yeah, okay. Good. So, say E.
After examining Eileen's voice box for just a few minutes, Dr. Pittman has no doubt what her problem is.
It was clear to me that she had the neurologic disorder, spasmodic dysphonia.
Spasmodic dysphonia is a rare neurological disorder in which the vocal folds spasm involuntarily during speech. In a healthy individual, the brain signals the vocal folds to vibrate and make the intended sounds. But in patients like Eileen, the signal malfunctions, sending the vocal folds into spasm and impairing normal speech.
We're not exactly sure what the cause of spasmodic dysphonia is. What we do know is that there is a problem in the brain, and that when it sends a motor signal to the larynx to start to speak, that signal is abnormal, and the larynx doesn't function normally, and then the voice decompensates.
I felt relieved. It made total sense, and it validated me. I wanted to get up and kiss this young guy.
Eileen is so thrilled to know she was right all along. She has Dr. Pittman call her husband with a diagnosis.
I think Eileen was anxious to tell me this information because I feel like she felt vindicated to a certain degree, that she was right, that it wasn't psychological, that it was really a physical condition and she wasn't out of her mind.
In fact, the diagnosis explains everything she's been experiencing for the last year.
Eileen's main symptoms are a tightness to the voice and the voice breaking. And spasmodic dysphonia causes those symptoms by actually causing the vocal folds to spasm so tight that she can't get out that sound.
The diagnosis also accounts for why Eileen sounded normal when she yelled.
The reason why Eileen could scream is because the neurologic pathway to screaming is different than the neurologic pathway to speaking. And so when you use a different pathway, you won't spasm.
Still, as relieved as she is to finally have a diagnosis, Eileen can't help but wonder why it took so long.
When you look at a patient's larynx with spasmodic dysphonia, their larynx actually is completely normal. It's only when they spasm do you actually notice that there's a problem. And if you don't have them speak, when you're looking down at the larynx, you won't actually see that spasm happen. It's not really clear how many people have spasmodic dysphonia. Sometimes they'll say approximately 50,000 in the United States, but most likely there are many, many more people than that.
It's not a well-known disease. Many doctors diagnose it as psychological, but that's a false diagnosis.
The condition won't get worse, but without a diagnosis, Eileen could have faced a difficult future.
So if Eileen was never diagnosed, I think she would have a lot of problem with the psychological part of dealing with spasmodic dysphonia.
Unfortunately, there is no cure for spasmodic dysphonia, but there is a treatment.
The main treatment for spasmodic dysphonia is injection of botulinum toxin into the laryngeal muscles. When you use botulinum toxin, it actually inhibits the nerve. And so for the muscle to regain function, the nerve actually has to regrow and resprout nerve endings. And that takes time, generally about 3 months or so. And that's why the patient needs to be re-injected every 3 months.
It's a treatment similar to the one used for wrinkles and frown lines. By blocking the impulses to Eileen's vocal muscles, they're simply no longer able to spasm.
And the first time you're very anxious about getting shots into your throat. I remember almost passing out and just the tears were coming down my face. It felt like forever, but it's only seconds.
And within just a few weeks of getting the shots, Eileen and everyone else can hear the difference in her voice.
Gradually over time, her voice did come back to full strength, and she was back to normal again.
She was yelling again, she was talking, and she was much more confident, much more like her old self again.
I could speak. I could speak on the phone, I could speak, I could have a conversation. I felt so happy.
Today, more than a year after her diagnosis, Eileen is back to living a very full and very loud life.
Go, 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 go!
I think she was afraid that she would never be able to talk again, that she would never be able to go back to the way it was. And now that it's possible that she can, she's very happy. It's made her stronger and better for it.
Eileen's voice is back to its normal state. I think if anything good has come out of this, it's probably that she doesn't take her health for granted.
For the rest of my life, I have to go get these injections. But compared to what it could be, I'll take the injections. My voice is 90% back to normal, and I'll live with that. That is phenomenal.
Come here, sweetheart. Come here, puppy. Thank you.